So good morning, and thank you everyone for watching the Kidney Foundation's webinar on Body Image and Self-Esteem, Part 3, Women's Health. My name is Sadia, and I'm the Programs Coordinator in the Ontario branch of the Kidney Foundation. The goal of this webinar is to start the dialogue with knowing that you are not alone when it comes to hair loss, weight changes, and how to love your body throughout the roller coaster of living with chronic kidney disease. We are honored to hear from some of our amazing patient and caregiver partners who are going to be sharing their personal struggles, fears, self-confidence, growth, and strength with empowering themselves throughout the kidney journey. Before we begin, we would like to recognize the Indigenous land that we are on. Inspired by the 94 recommended calls to action made by the Truth and Reconciliation Commission of Canada, land acknowledgements are a necessary first step toward honoring the original occupants of a place. They also help Canadians to recognize and respect Indigenous peoples' inherent kinship beliefs when it comes to the land, especially since those beliefs were restricted for so long. We would like to acknowledge that I am located in Toronto, which is the traditional territory of many nations. It is covered by the Treaty 13 signed with the Mississauga of the Credit and is still home to many First Nations, Inuit, and Métis peoples. Recognizing that we all work and live in various places and that you may be joining us from a different traditional Indigenous territory, I recognize everyone to take a moment to reflect on that and to acknowledge it. We would also like to thank our amazing sponsors for these webinar series: GSK, Horizon, Jensen, Otsuka, Paladin, and Takata. Their ongoing support allows us to bring many together, like today, to have broader, bolder, and braver conversations. The Kidney Foundation believes passionately that knowledge is power. Today's goal is to provide you with that knowledge, help you understand, again, that you are not alone, and ultimately support you with feeling more empowered. This is the right time to talk about body image and self-esteem. The information shared in today's webinar is current as of today, January 29th, 2023. Material shared in this presentation is not intended to be medical advice. You should speak to your doctor and care team about your own individual situation. This information is intended for a Canadian audience. We are thrilled now to introduce all of our amazing speakers one by one. Thank you all for taking the time to share this important information today. I would now like to welcome and introduce our amazing moderator for this webinar, Dr. Veronica Silva, who will share a little bit about herself. Over to you, Dr. Silva.
Thank you, Sadia, and welcome everyone to this very important webinar, at least from the nephrology perspective. As a physician, I'm a kidney specialist working at Trillium Health Partners for the last 10 years. Next. We do see that our kidney patients are affected by body image quite often, even more so than other patients who have other illnesses. And the way that we try to make things better is by raising awareness. So webinars such as today's is very important to disseminate information and disseminate knowledge. Our patients are particularly affected with their body image in situations such as their need for dialysis. So they will often have bulging veins in their hands or in their arms. They will often have catheters in certain parts of their body that can't be visible and can actually prevent them from doing certain activities. Their skin may be of a different, darker discoloration, and there is also issues with hair loss. There's many ways that kidney disease can impact your body image, and this is why we really need to focus on. Next. On a personal level, this is the true reason why I became a kidney doctor. My grandfather had kidney disease and kidney failure from diabetes. He went through the journey with us at home, and he went through both hemodialysis, where he needed a catheter right underneath his collarbone, and then he was on peritoneal dialysis with a catheter in his abdomen. I can tell you that it was very challenging for him, even at his elderly age, to have a foreign body sticking out of his chest area. He initially did not want to leave the house. He didn't want anybody to see him or note that he was different now. And with everyone at home supporting him in his journey, he was able to overcome that. In fact, if you see the picture on the far right, he is in a hammock in Central America where he was born, vacationing with PD. What that means, the peritoneal dialysis catheter in his tummy. And he was actually dialyzing in that picture. He became a speaker at our hospital for patients who were interested in peritoneal dialysis, and he shared his experience on how it felt to be on it. And that way helped many patients decide what they wanted to do with their kidney disease. So this is why I'm here, and that's my story. Next. I'd like to welcome the other speakers today who will share their journey, share their experience with body image, particularly affecting their journey throughout their kidney disease. And I will first pass off to Michelle. Michelle?
Thanks, Dr. Silva. I'm going to go through my story, which started in 2019. So next slide. This picture is from 2019, about a week prior to my diagnosis. And so in 2019, I was feeling a little bit sick. I kind of just thought it was stress, and I went to the doctor, and they did blood work and called me a few days later and said to get right to emerge. And I was admitted into the hospital. So that's what these 3 photos are from. I was in the hospital for 3 weeks. And as you can see, I was retaining a lot of fluid. My face was very swollen. I had started dialysis. I had a chest catheter. I was doing plasmapheresis and on heavy steroids and chemo medication. And it was a very long 3 weeks. It affected me a lot, just seeing these photos again and how different they looked from how I was previously. Next slide. And then I decided to do home hemodialysis. So I was in the training process for all of these photos. And even though I had stopped plasmapheresis at this time, I was still tapering off of steroids. So as you can see, my face was still very, very swollen and very different than I looked previously. Next slide. So I did home hemodialysis for 2.5 years and had the chest catheter the entire time, which was, it became easier, but at the beginning it was really difficult to know that sometimes you could see the outer lining or you could see the catheter in general. And a big moment for me that was difficult was shopping for my wedding dress. I tried really hard to not have it show in any of the dresses, and it was a really hard day seeing dresses that you would have previously probably worn, but just didn't go with your body anymore. And so I did end up picking a dress, but it was a difficult situation to go through. Next slide. And then in 2021, in December, after 2.5 years, I received my kidney transplant from my friend. And the catheter was removed while I was still in the hospital. I was very, very thankful for that. But I started to have hair thinning throughout due to the medications, and I have had a hard time losing weight since then. I'm eating healthy and everything, but it's just kind of something with the medications that stick. But since my transplant a little over a year ago, I was able to have my wedding reception and wear my dress how I had originally envisioned without covering for the catheter. And I also went on my honeymoon, so I was able to travel. So for me, there's been a lot of changes over the last 3 years. And with that have come lots of body changes as well. So I'm very happy to be here today. And I am going to pass it along to Sean to introduce herself.
Thank you, Michelle. My name is Sean. Sorry about my voice. It's residual effects from parathyroid surgery. Anyways, my kidney journey began in 2018 when I was diagnosed at stage 4. And that came as a complete shock to me. I was completely devastated. And what made it worse is that the nephrologist told me that within a year, I would need to get a transplant or go on dialysis. So I started, telling all my friends, my family about, my situation, asked them to pass it on. I did 2 videos, but then nothing. But then my mom, thank goodness, being mother that she is, she immediately said she would donate one of her kidneys to me. And my sister as well did the same. But for me, I was determined to maintain my kidney function or improve it. And later on, I realized I really couldn't improve it. I stuck to the diet as much as possible. The renal diet was really, really difficult. I thought I was healthy and eating well, but it turned out that I was eating too much protein, too much fruits and vegetables, especially tropical fruits. So too much potassium and too much fiber. So that was difficult, but I got, it was okay. I lost 5 pounds within the first month, but then became stable. So I continue maintaining my diet and watch my blood count, go up and down, but mainly stayed pretty good until about 3.5 years later, close to the end of 2021. I got a problem with my parathyroids and had to have surgery. And in the meantime, my mom unfortunately passed away. I miss her so much. And then my sister at that time decided that it was time for them to start testing her. So she went through all the testing. Everything was going well. She was a match. And, the doctors kept telling me in the meantime, prepare for dialysis. And I was very hesitant because I was feeling okay. I didn't have any symptoms other than fatigue. And it was just, how do you start dialysis? When, my sister's getting worked up and I'm feeling fine. It was very difficult. But anyways, everything sort of came, to a standstill. And they told my sister that they're stopping the process because hypertension actually runs in my family. My mom actually passed away from a stroke. So she wasn't going to be good either. And, that was not good for me. But at that time, that's when, I was speaking to people on the peer support group from the Kidney Foundation. And I heard all the different stories about, people just falling ill suddenly and needed dialysis right away. And I didn't want that happening with me. So at that point, I just decided, okay, it's time. So then I just made peace with everything, accepted it, and told my doctors that I was ready now to get, my that catheter inserted. I chose peritoneal dialysis. I'm doing it at home, and I've been doing it now for seven months, and things are going okay. It's a bit of an adjustment, but it's okay. I'm still hopeful though to have a transplant one day, and just try to stay positive and optimistic, and at least I know that we have this dialysis to keep us going. So on the pictures here, the two left ones are my gardens at the front. I have gardens at the back as well as the side. They keep me grounded. They keep me just busy and occupied, and I really love flowers. And at the right, it's just me out with friends at a dance. That's another passion of mine, is dancing. And so I really enjoy, being out and being happy. Next slide, please. Okay, the photo on the left is a photo of my family, except for the kids. My mom, my stepdad, my sister, and myself, and my brother. And that's usually, that was an outing. On Mother's Day, my mom likes to go to our local Chinese restaurant for all you can eat. And we just enjoy doing that with her. And the photo on the right is, that was a birthday. Mom and I share the same birth month, including actually 4 days apart. So when we go out as a family on her birthday, we celebrate together, and we just enjoy seafood. Next slide, please. So yeah, in terms of body image, I've just, other than having the catheter attached to me, this is now something that I'm dealing with, is a skin rash. And this one is, look, it's right here, my chest. So it's I guess it's easy to cover up in the winter months, but I find that with covering it up, it itches more and it burns more. So I try not to really hide it too much. Hopefully I'll see somebody about it and maybe it'll get cleared up, maybe it won't. Either way, it's a part of the journey and it is what it is. Okay, so thank you. That's all about me for now. And over to you, Uzma.
Thank you so much, Sean. And hi, everyone. My name is Uzma. And a little bit about me. I was a caregiver for my mom, Rihanna, and she passed away in 2021. It'll be 2 years next month. And I live in Mississauga with my kids and my husband and my mother and father-in-law. So this is my journey that I will talk about regarding my mom. Next slide, please. So this is my mom, and she had her kidney failure in 2016 and was refusing any talks about dialysis. So it was quite a big challenge for our family. And Kidney Foundation is something that actually helped her, visiting that along with the whole family, talking with her. Family played a big part with my siblings and myself. I was one of the primary caregivers along with my sisters, but so they convinced her and she got convinced and eventually did peritoneal dialysis and had some struggles with the catheter, but she had extended her life. Actually, 2021 is when she passed away. So next slide, please. She was a very vibrant personality. This is, she loved going places. She loved dressing up. She was a designer, that she was a business person. She dressed other people And the picture, this is her being able to attend grandchildren's graduations. The one on both either side are my children, and the one in the middle is my nephew. He's become a doctor, and he was also always by her side, and she was always proud of her grandchildren, and the one in the middle, I would specifically like to mention, is because being a designer, she loved wearing saris. It's a very traditional outfit. And having the catheter and having going through peritoneal dialysis um, just made it a little difficult. And then having some weight put on. So she had to change her dressing style. But she went with it very proudly and courageously and had to decide to change her dressing and went into a pant and shirt style, and which she'd never done almost, I mean, like once she'd gotten married, let's say. But she did it. She tried her best and went ahead with that and never gave up. Next slide, please. And here we are. So this is with on the left is her greatest treasures, as she called us three daughters, her daughters, myself on the right, and my other two sisters, Seema and Maliha. And we were her caregivers, and we looked after her and supported her in all her needs and encouraged her for accepting all the changes that she had in her kidney journey, especially with her diet and all her appointments. I was her primary, so took her for all her appointments and needs. And it was, and my brothers on the other side of the world, but we managed, we encouraged her, and it was very tough. And especially her last year was definitely very tough. And with COVID, it was extremely more. And on the right, having done dialysis gave her a few extra years, and this is one of her great grandchildren that she was able to hold and spend some time with. And she ended up having 5 great grandchildren, so she was able to FaceTime with some and be able to see some, and so that was just beautiful, and she got to witness that. Next slide, please. So this is me spending extra time. The one on the left is she had started her kidney journey, and the one on the right is different appointments. On the right, at Credit Valley at one of her appointments. So as a caregiver to my mom, spending quality time with my mother was the most important and meaningful impact moments we shared. And this experience has given me and provided me a voice to share with others how to stay empowered and how to advocate for your loved ones and how to stay positive through their journey. And being a caregiver comes naturally to me, and it was an honor and blessing to be one to my late mother. Thank you. And I will now over to Kristen.
Thank you, Uzma. My name is Kristen. I am also a caregiver to a child who had a transplant in March of 2021. The slideshow begins with a family photo that was taken before my daughter Lily was diagnosed. So the first picture in the slideshow, I'll just wait a minute. There it is. The first picture in the slideshow is a family picture that was taken the Halloween before her diagnosis. So that was the Halloween of 2018. So that's the 4 of us. And then she started to show symptoms just a month following in November of 2018. And then that January of 2019, she was diagnosed with FSGS. And then by March of that year, she was hospitalized for 120 days. So the following photos that are shown, so the next one there, you can see a little bit of the difference. I only shared photos that I felt she would be comfortable with. So the difference might be minimal in some of the photos, but there was quite a phenomenal difference of up to 10 pounds of fluid difference within 3 months. So she was 120 days inpatient, and some of the pictures really show some of the phenomenal things that were done to really support Lily. And one of them was this Batman. So Lily wasn't able to get a day pass we were really hoping that she could go to her 4-year-old cousin's birthday. And Batman came to the birthday party, and she couldn't go. We didn't even tell her Batman was coming to the birthday party because we didn't want her to feel sad. And my sister-in-law asked Batman if after the birthday party he would be okay going by the hospital to see her. And so this Batman that was hired just for the birthday party came by the hospital on his own and stopped in to visit her. So that was really special. And then the next picture was one of the times that she wasn't, so she kind of bounced in and out of the hospital a little bit and then did like a really long stint. So this is her out of the hospital. You can still see some swelling. We did break down and get a dog. So a lot of the family rules changed when your child is going through a lot. So there was a puppy brought in, although she's massive. Next slide, please. I picked this picture here, the selfie. So even though Lily was 7 at diagnosis, here she is. She was on hemodialysis at the hospital 3 to 4 days a week. And then she was coming home for part of that journey and would go out to Brownies once a week. So here she is. You can see she's still quite swollen. She would have had dialysis that day and was giving the peace sign and going off to her Brownie meeting. The next picture is one of her favorite things to do at the hospital was participate in dog therapy, which was one of the reasons that we did go ahead and let her get a puppy. Next slide. So one of the great supports for us during the hospital time was having family visits pre-COVID when we were able to have them, and doing as many things as possible when she had day passes or when we were home. Things like the father-daughter ball you can see in the next picture. Next slide. And then this picture is almost 2 years post-transplant, so about 1.5 years. This is Lily today. So she's had her transplant. She has had recurrence of the FSGS, but she's given it her all in every opportunity she has to get out there and be a normal 11-year-old. She's out there doing it. So this was over the winter break, and she was out with her friends skating at the local outside arena. So Lily has gone through a lot of body image changes. She was diagnosed during that 120 days with malnutrition, did have to have a G-tube placed. So there's been a lot of up and downs with her disease. There's also a lot of swelling. So that is a lot of changes and challenges to the body image at such a young age. But here she is smiling through it all. In all of those pictures, there was a lot of smiling. So I'm quite a proud mama. And I'll pass it over to Christine. Thank you.
Thanks, Kristen. One thing that's interesting when we're a part of the Kidney Foundation peer support is that as much as our stories are so much alike, they can be so different. And just listening to all the different stories, probably with the exception of Kristen, because I didn't have kidney issues as a child, but there's a little bit of everybody that I can hear. So that the cause of my kidney failure was most likely type 1 diabetes. I was diagnosed with diabetes when I was 7, type 1 diabetes. And so years later, almost 23 years ago, I ended up with having a kidney transplant, a living related kidney transplant. And dialysis and learning you have to have a transplant or go on dialysis isn't the easiest thing. So if you're a patient and you feel that way, we definitely can understand that. So before the transplant, I was able to see my my post-transplant doctor. We had a little meet and greet. And while I was speaking with him, I started to get upset, and he asked me why. And I told him that, you know, diabetes, type 1, especially diabetes, makes it difficult to have children, even if you can. And having or needing a transplant would just make that harder. And he said, you know what, let's get through the transplant. Let's see how you're doing. And post-transplant, we'll work with the nephrology clinic and the clinic team, and we'll see where we end up. So my husband and I were more than happy to adopt. We had talked about it long before the idea of me needing a kidney transplant was um, even down the road. And so we, you know, we were more than happy to adopt a child or children. But at the same time, I still had this idea in my head that I wanted to go through the experience of falling pregnant and having a child of my own. And so after a relatively short time of being on dialysis, I did have to go on dialysis in an emergency situation. I lost my function pretty quickly, and I ended up on hemodialysis. And we've already talked about having the catheter in our chest. And I was working, so I had to hide it with my clothes. And that's not easy to do either, although a wedding dress obviously is more difficult than just your clothes going to work. But anyway, everything went well, and I was able to have a daughter post-transplant. The picture you just saw was of my daughter, our daughter, rather. She was 3, and she was telling everybody that she was going to blow out the candles on her cake. This picture, the one on the right-hand side, is my husband, Steve. He's in the NICU. Lorna was a premature baby, and there she is, just a week old, adoring her dad. And then there's just a picture of Lorna and I at a friend's house. She was about 4 there. So, but one of the things that happened while having Lorna was her, sorry, excuse me, was me gaining weight. I was able to breastfeed, and post breastfeeding, I gained a lot of weight. And the other thing that happened, even though I love my daughter, and the smile on my face was consistent from the time she was born and even till today. I really couldn't say enough about her. She's an amazing child, and I love every second that she's around. I still have serious problems with postpartum depression, and having postpartum and having and dealing with growing overweight rather quickly isn't simple. And even though you're doing the things you can to try to take care of those things, the doctors and the transplant team were incredible, and still are incredible, to help me get through it emotionally and physically. This picture is our incredible daughter. She's smart and talented, and a great athlete. And I can't say enough about her, as I already mentioned. She's attending Laurier University for biology, and double major in biology and psychology. So the picture beside the single picture of Lorna is my sister Lorna, who was my kidney donor. So I guess you caught that we've named our daughter after my sister, for saving my life, obviously, and being a huge part of our daughter being able to be born. beside my sister is my mom, who's a really supportive and really a great person. And I obviously love my mom. And then beside is my daughter. Again, that was a day we were celebrating her graduation from high school. So I do have, as I said, I do have issues with ongoing issues with medications and other things, and that also attribute or contribute rather to my weight gain and trying to work through depression and that kind of thing. So anyway, I'd like to pass on, or rather pass or talk to, sorry, Dr. Silva. I'm trying to say I'd like to pass it back on to Dr. Silva. Thank you very much.
Thank you, Christine. Thank you, Kristen, Uzma, Sean, and Michelle. As patients and caregivers to patients with kidney disease, it's always touching to hear you guys speak. This is our second round doing this fireside chat. And I have to say that there are certain things that I will take away from today's session that have touched me really deeply. For instance, Michelle, the way your last photo with the catheter and how you looked, how you owned it, you were showing it, you were proud. I know you had the issues with your wedding dress, but looking at that picture, you could never tell. You would be the photo perfect poster woman for perm casts to advertise across any dialysis unit. And Kristen, I have to say that when I saw for the first time a picture of Lily, this is why I did not become a pediatric nephrologist. I don't know how I would have been able to work with children. Her selfie as she's going out to the brownies with the peace sign. Oh my gosh, that was so touching. That picture says a lot about who she is and all the support that she's received from her family. It's amazing to see such a resilient little child going through so much and yet have a smile on her face like that. And I think children tend to do that. When you see children going through, the ER with a broken arm, with a whatever, and they're not even complaining, they're just smiling at you. We can learn a lot from kids for that, I think. Christine, oh my gosh, the picture of your 2-year-old going like this, that she's going to blow out her candles, to me says you put yourself last because you wanted to be a mom and you knew the risks that it involved becoming a mom. And pregnancy in patients with kidney disease is very challenging, to say the least. And it comes sometimes at a high price with complications. But you achieve that, and you have a daughter that you're so proud of. And despite all the hurdles you're still facing with weight and depression that started postpartum, you have her. And she's I mean, I don't mean to say it like this because it underestimates the value, but she's like your big trophy that you can admire every day, right? And I think that is something that is something that as a mom you always can sometimes take for granted, right? Your children. So I think I thank you for that. Uzma, I love the way you looked after your mom. You brought her to every single event she could possibly. You could see your mom living a normal life after dialysis. Like nothing stopped her. She was at graduations, she was holding her great grandkids. She was living life beyond kidney failure. And that could only have been possible with the support of you and your sisters. And I think that I identify 100% because that's what we wanted as a family for my grandfather. I wasn't his nephrologist, I was his granddaughter, his caregiver. And it was nerve-wracking bringing him to appointments because I was like, oh no, they're going to say he needs dialysis. Oh no, they're going to say he needs dialysis. So all that anticipation, I remember taking him to his multiple medical appointments. Sean, I love the picture of you sitting in a dance. I think it was a party, and you talked about how you love to dance and how shocking everything came to be, and how the peritoneal dialysis catheter now is in you, and the skin changes, but that hasn't stopped you from living. That hasn't stopped you from doing the things that you enjoy. And I love seeing that picture and seeing the picture of your garden. How you, in the 7 months that you've been on dialysis, you're living it to the fullest. And I congratulate you for that. So, Michelle, if there's any piece of advice you would give to young women going through this journey, what would you say to them?
I think that the most important part is to have around you a good support system. Make time for the people that make time for you, sort of thing. I did get better with my chest catheter, but that took a lot of support from people like my husband and my friends and my family. And they really pushed that you shouldn't be ashamed of your catheter. It was something that was keeping you alive, and it was more a symbol of bravery than everything else. And I think that if you let people in and you let them support you, that's probably the best advice that I can give.
And with respect, you mentioned your husband. Did you didn't meet him before you had your catheter, did you?
I did, yes. We were engaged for a month before I was diagnosed.
Okay.
So he was with me through all of that. Actually, in the hospital, in my 3-week stint in the hospital, when my face was all swollen and I was retaining fluid, I tried to break up with him and told him that he should probably find someone a little bit more healthy and wouldn't have issues having babies later on. And obviously he didn't take me up on my offer. We got married. It happened. But it was a very emotional time. And he was a great support system, and he still is. He learned how to do the dialysis machine, and he definitely helped me through everything.
Kristen, how would you, what comforting words would you give another mom whose child is going through this journey? What helped you the most?
What helped me the most?
To get you through?
I guess seeing Lily's resilience, really, just knowing that she could do it, so I could do it. So I think that whole, the support system and the teamwork and the one day at a time, right? There's going to be hard days, but there's also going to be lots of good days. There's still going to be brownies. She's still going to be at the core of it all. She's a kid and she needs to be a kid. So just finding ways to, you know, still make it all work. Like through it all, Michelle still had a wedding, right? Through it all, Lily still went to Brownies. We found a way to get her back to school through a transplant, through COVID. So I think my words of advice would be, you know, learn all you can, reach out for help, find your support system. And then prioritize, you know, work with your child, listen to your child, and find the new normal.
Mhm.
Yeah. We don't say no. That's our thing. We don't say no. We say, how can we do it now? So how can we do it now? It might be different. It might be different, and we might have to like compromise with mom's rules. So, you know, she might be the only one in her class who wears a mask. She might eat lunch in a different classroom. We do things a little differently around here. We have this really fun arcade near our house that she's been asking to go back to for 3 years. And I feel it's a germ-infested pool. And she's been asking to go back. And we went back yesterday for the first time, and she had a blast. And we made it happen. We went right when the doors opened, so it would be as quiet as possible. We had a plan for getting in and getting out. And we were all masked, and you know, and so we don't say no, we say, how are we going to do it now? That's just, you know, so things are different, and we have to work within, you know, the confines of, you know, having a G-tube, or when she was on dialysis. And so, yeah, things will look differently, but it's not a no.
Wow.
Mhm.
Thank you for that, Kristen. Christine, how are you doing? Oh, there you go. Can you talk to us about some of the medications and how they've changed your body image?
Yes. There's one in particular that I had a hard time with, and not every patient does, and it's prednisone. It was after having Lorna, I discovered that I had I'll call it an allergy to prednisone, and it had made me gain extra weight. And on top of that, it caused severe depression, even more so. So it was another thing I had to deal with. And you know, when you're depressed, when you're like, it's not just feeling bad about, you know, having a bad day. It's when you have depression and you know it, it's very different. And so, you know, eating habits don't help. You know, there was days I wouldn't eat very much, which is terrible for diabetes, and other days I would eat way too much, and that's not good for diabetes and your health in general. So, but so there's other meds I take for other conditions that also cause weight gain, and it makes it harder to, you know, look at yourself in the mirror and remember what it was like when you were a lot thinner. And you know, people that met me more recently, they don't know that I wasn't this size. I was a much thinner person. And so I shouldn't get into that too much, because one of the things that's helped is that, you know, my family and my friends and my husband Steve and Lorna, they've all been so supportive to help me not worry so much about that, the weight gain and everything else, and worry about or think about more that, you know, you're doing well today, you look great today, that kind of stuff. It really helps. And so definitely, you know, stay close to your friends. I think Michelle was sort of saying that kind of thing. And another, like all through this, like if you want to do something in your life, talk to your doctor. but also talk to your doctor about meds that are causing problems. It was actually my doctor that recognized I was having an issue with prednisone as opposed to me going to the doctor. And he changed my med, and so it reduced the depression. And to help even more, I was sent to a psychiatrist for some help, medical help that way, and some chatting too. And so if your doctors can help you with the medication, that's not always possible, but all those things put together help, and help you see yourself better and see you as a stronger person.
How was getting pregnant after a transplant for you?
It wasn't simple. I had some issues getting pregnant that I hadn't had. Well, I mean, I had, and so I was seeing a fertility specialist, and also I was already 35 when I started trying, so they wanted to help me get pregnant as soon as possible, because of my age. And I ended up not falling pregnant until a couple years later. So, but I think for the most part, other than getting blood tests done every day, and getting tested all the time to see if you're pregnant, and um, these different things, I think the other parts of it were the same for people who have fertility issues. Um, and one thing though, that's a good question, that for me, and of course everybody's different in this case, I never felt better than when I was pregnant. I don't know whether my hormones were more balanced, or it was just like a mentality that I was so thrilled that the pregnancy was continuing and the baby was growing, and my husband and I were so happy that we were able to go through this, and I got, my wish came true. I wish that I'd be able to have the experience of being pregnant, um, uh, despite the challenges, the kidney, my kidney failure and being on meds and all the other parts to it slowed down the ability to become pregnant. But once I was, it was a dream come true. And then of course having the baby was just making it to the point where she was born. Again, it was all a prayer, a wish, all these different words that came true.
Thank you for sharing that. And thank you for having the courage to share all of your stories and the challenges that have come across your journey as patients and caregivers for those who have kidney disease. Uzma, as the primary caregiver for your mom, what were the challenges with other family and friends, and trying to look as best after your mom as best as possible that didn't coincide with how things were, like challenges in general?
Well, there were a lot of challenges, definitely, and you would know best too, right? And the biggest challenge, I mean, is just making my mom understand her journey, and because it was all too new for her, and just her understanding kidney failure. And the biggest challenge also would be diet, and just getting to learn to uh, live with a new type of diet, or sodium control, fluid control, everything. My mom loved her food. She fed everybody around her, and she was a great cook, fed us all. So learning to live with that, and then also living with family. My eldest sister moved from Florida, moved with her husband and son back here in her home, and bought her home so that my mom did not have to pay mortgage again, and so that she was free of that, and stayed with her. So that helped relieve a big that was a big relief for me and my other sister who lived here, because there's somebody now full time. As soon as we found out she's going to be having dialysis, and that my mom finally agreed to do. So that was just one of the biggest challenge, how are we going to cope with that? So that was the biggest thing. And then when you're living with a family and everybody's eating different types of food, so you have to accommodate that. And but we learned. I mean, I attended every single dietitian classes with her, educated her more on that, and we accommodated it with our kind of cultural food, and we didn't take it away from her. We added it to her, and she became accustomed to it, and it was good. But family unity is very, very, very important, and having everybody on the same page. And but anytime she did go through depression, she did. But what happened is we all took turns. All of us siblings were 5, and everybody had a different connection. So we would all take our turns to have that little talk and understanding with her, and to make her understand different things. And so that it was challenging, because there are those ups and downs, her weight, her fluid intake, but also the water retention, just the weight gain. And she was a diabetic too. She had blood pressure. She had a heart. She had it's just overwhelming. And, with just the appointments itself. I mean, I have my own home, and I would constantly be there the full time. So just the challenges to get her to her appointments. And so I gave up my job. I wasn't, so that somebody is available full time for her. And my other sisters were working, but I was full time with her. So she was very dependent on me and very comfortable. So even when I was admitted 2 or 3 times during this whole process in the hospital, I would attend, and my sister would take her to the hospital appointment, but I'd be on the phone with the doctor, because my mom felt comfortable that I'm talking about her prescriptions or medicine or things like that. So those were the kind of challenges, but we pulled through as a family. Family unity is the most important.
Mhm.
She looked like a very stoic woman from those pictures. And culturally, how do you think having a dialysis catheter affected her?
Well, it's physical. So she didn't want it, first of all. She refused for quite a while. It was very challenging to convince her. And she just didn't want to be hooked up to a machine. And she said, no, just give me some medicine, and that's it. I don't want. Let it be in its own time. But we said it's not anything that is wrong with it. Think of it as a medication. And so we convinced her somehow. Like I said, meetings at Kidney Foundation, they were not virtual at that time, they were physical. So she met people, and Sadia was one of the people that she met. And she was very happy. Like, she was so surprised with how normal everybody is. And I said, that is how life is. And she was very surprised. Everybody convinced her that you have family, you have daughters who are willing to take you to your appointments or living with you. And she didn't want to burden anybody. That's how the concept was. She felt that she's burdening everyone or her family. But we had to show her that we are doing it out of love, and we want her to be alive with us for a longer time, and give us her support, her guidance to us, and which we were blessed with for extra few years. And it's just that the physical aspect of it, and like the dressing part, that also came in, right? And but there were ways of hiding that, and there were ways, and she got used to it. But at last year, the bloating, the edema, that did come in the way. That did a little bit, but with physical, like clothes and stuff, she got used to it. But just the last year did it. There were complications for her before she passed away. So it is what it is.
Sean, how in such a short time that you've been on peritoneal dialysis, how comfortable are you now with your catheter?
I'm a lot more comfortable with it now. At first, I wasn't, because it was about a few weeks after I got the catheter inserted. It was in the summer. I was wearing a skirt and it just fell out. I laugh about it then, and I joked with my friends about it. And I said, oh, it was funny at the time, but after that happened, it was jolting me, you know, because the thing that I had around my waist wasn't sitting right. And I just thought, okay, that could not happen again. So I set out to make my own belt.
Mm.
And so I designed a belt, and one of the ladies from my church, I asked her, because I know she sewed, because she was making me masks during the pandemic. And immediately she says yes. And I was shocked, well, not shocked, but I was just happy and surprised that she actually set out making me these holder immediately. So now I'm quite comfortable. I know it's secure, it's safe, it's going to be protected, and it'll never fall out again. I don't need to be embarrassed out in public. But I still, at nighttime, I know, especially for the first couple months, I was really concerned about it getting caught up in the bed sheets and maybe tugging at me or maybe pulling out of me. It was a little scary for a while. You know, I was always checking to make sure it was okay. And whenever I roll over, you know, because sometimes I have to change positions for draining with the machine. And sometimes, and because it's on my left side, so it's like, can I be on my left side, or do I have to be on my back only, or on my right side only? But now it's a lot more comfortable now, I must say. It's still, you know, like it's still this foreign thing attached to me, and I'm very conscious of it, because sometimes too, even with my clothing, only now do I start wearing jeans again, because it was very tender. You know, I'm not a big person. I only weigh like 120 pounds, so I could feel it underneath my skin. And so anything at all that was maybe too hard or was rubbing against my exit site, even though it was covered with a bandage, just felt uncomfortable for a while. But it's getting better, so I'm okay with it now. I know I have to have it, so it is what it is.
So you see it as your lifeline now?
It is absolutely my lifeline. That's how I get my treatment. I call it my treatment. It's my support. And so even the machine, I was saying to my sister, I need to name him because he takes care of me every night.
At the children's hospital, all of the machines are named.
Yeah, I haven't quite come up with a name yet.
They're all named after the Harry Potter characters, I think. I don't know how it started. They were already named when we got there. So they had no significance to my daughter, but they are already named. So
So he's my bedtime partner, because my husband passed, so he's my bedtime partner now. He takes care of me. He takes care, and I said, notice I said he.
Yes, we noticed.
He takes care of me at night while I sleep.
a male caregiver name.
Yeah, right.
Fabio comes to mind, or something like that.
I like that name.
Fabio.
Sounds exotic.
Yeah.
Yeah.
How do you think connecting with other people going through this journey could help someone in your case, Sean?
You know, the peer support group has been a tremendous support for me, because during this journey, like even before I had to go on dialysis, I was just listening to all the stories and taking it all in, asking questions. And it was really, really difficult. But they helped me. They helped me through that, you know, even to finally make the decision, okay, this is what I need to do. So going forward, like I actually did I have an article in the kidney article. There's a write-up in the kidney journal this month. And so yeah, I share my story now openly, even though I'm usually so private and so, you know, closed off a little bit. But I share openly now, because if I can help another person, even just one person, it will make a difference to me, because I know that I felt very alone in my journey. I didn't realize there was a whole look at all of us, right? And we're not all of it. There's so many people with kidney problems. And I didn't know the foundation existed really until my social worker at the hospital mentioned it. And so I was just really grateful for that and the support they've given me. And so, you pay it forward. You teach one, and you pass the word out to other people. If someone is struggling and they need to talk to me about it, I can say, hey, I've been there. I'm in this journey as well. I understand your frustration, I understand your pain, understand your struggles. And so I think that helps. It helps to have someone who's going, like even my sister, she would say certain things. I'm thinking, you're not the one in it, right? I mean, I love you and I know you love me, but you're not feeling what I'm feeling. You're not experiencing what I'm feeling. And even my friends would say, oh, Sean, what's happening? You're the healthiest person that I know. You don't drink, you don't smoke, you don't have any bad habits. You eat well. I'm like, yeah, I thought I was eating well. But things happen. Kidney disease doesn't care who you are. And so, we just help each other along the way. And you, Dr. Silva, thank you for all that you do and all the nephrologists and all the, frontline staff, nurses, social workers, dietitians, everybody. Take care of us. We couldn't do it alone.
Sean, I learned very early on when I used to go to these meetings to talk about dialysis therapies to patients who are at about the point to make a decision, right? Whether they're going to choose peritoneal or hemodialysis. And I was always asked to speak on the benefits of, doing peritoneal dialysis. I would go up there, do my slideshow. These are the medical benefits, blah, blah, blah. And then my grandfather, I would ask him to come up and he just took over the show. Like no one cared about the medical benefits. Patients cared about what other patients had to say about what it felt to be in that position and what it feels like to be where they were at the time. So sharing that experience, I have to tell you guys, is far more important, and the impact of that goes way further than what any doctor could possibly tell patients. So when he would say, it's scary, I'm doing it, but life goes on, I had patients years later come up to me and say, I remember your grandfather, and this is why I chose peritoneal dialysis, because I remember how well he was doing and how happy he was. So I think, like I said, that piece that's why we're here, to share those stories, because they're so impactful. More so than we will ever know how many people it touched. And Michelle, I want to ask you about social media, because you were so proactively capturing your journey with selfies from the beginning. And it's not something that a lot of people would think of doing, but how do you think social media could help or could be an obstacle for patients who are having body image with their issues with their kidney disease?
I started using social media right after. I was diagnosed in July, and the first kidney walk I did was in September. So I think that kind of pushed it as well. I had a reason to post. And I was recently engaged. I was planning my wedding, and you can't really hide the fact that your face was bigger. So if I was going to post anything that had a photo of me in it, you would see something was going on. And so instead of having people think about what was going on or make their own assumptions about what was going on. I kind of decided to beat everybody to the punch and just say, this is what I'm going through. This is how you can help. This is how you can learn about it if you want to. And that definitely helped me get a donor for sure. I didn't specifically ask anybody if they would be willing to fill out the application and donate, but I just spoke about my story a lot. I put it out on social media. I was open when people asked me about it. I tried not to say like, oh, I'm fine. And that kind of, it gives people the opportunity to look into it if they want to. You're not necessarily forcing them to do it, but if it's something that they want to learn about, they'll do that on their own. They'll look into it. They'll offer if they feel like they want to. And I know that social media isn't for everybody, and it was definitely scary sometimes to put your story out there and to know that people on your social media from like elementary school 25 years like are seeing all about your life so upfront. But I found it really beneficial, and people that you kind of weren't as close with anymore, like those people come back, right? They want to support you, and you kind of see who in your life is going to be there for the long haul, right? Like who really cares about how you go forward. So I would definitely suggest, if you're comfortable, to post on social media and find who you're comfortable with and see who could possibly be a donor if that's what you're looking for.
Kristen, with respects to Lily, she's going to be hitting the teenage years pretty soon.
Yes.
I can't stress enough how painful that is, having two of my own at the moment. How are like empowering Lily as she, steps into the next phase of her life?
Mhm.
How are you anticipating that to work itself out?
I think it will be tricky. I think it will definitely be tricky. Being a teenager with kidney disease will be tricky, and she's definitely had a mixed relationship with kidney disease. So, whereas what I mean by that is at times she's quite empowered by it. She was like the Kidney Walk ambassador this year for our local chapter, and she loved that. And a local business sponsored her, and there was a poster up, and she was quite proud of it. And then when it comes to school, she tends to be quite private and doesn't want to be the kidney kid. Although her closest friends know, and we've done fundraisers at the school, and we're doing another fundraiser for the local hospital's dialysis unit in Kidney Month in March. So she knows the school knows, and she's okay doing those things because she does like doing fundraisers and she does like those sorts of empowerment. But then she also doesn't want the label of the kidney kid. So I know she definitely wants her privacy. That's why, the slideshow, we were very careful what pictures we picked. We had, made sure she had a say in them. So it's definitely, going into teenage years is going to be a definite balance. I have to say, though, that she's extremely determined. She's very independent. So from the age of 9, she was giving her own needles. Even with a G-tube, she's wearing crop tops. So I'm positively optimistic that she's going to own this. She's going to rock it. But we've also put supports in place. So everyone in our family, you know, we have a rule. I like my rules. We're all in therapy. So, you know, it's taken a little bit of time. She's on her third therapist. So I've told her, you know, it can take some time. You can find the right fit for you, and that's okay. But we all do have to have someone that we talk to about our feelings, and especially going into the teen years, it's really important. So the current therapist she has, we've let her know that this is someone who specializes with teens, and she's super proud of that. And so that seems to be a good fit. And like I said, we just let her know that everyone in our family has someone that they talk to. And so I'm hoping that sets her up for success. You know, having the right supports in place. And we'll just have to kind of keep our ear to the ground and watch how it goes. But yeah, it's going to be a fine balance, I think, and definitely be tricky.
But it's so great that you've made it open. Like, you're all talking about it. You're all talking about how you know, speak to a therapist, and this is the norm in this house. And, you know, we talk about issues. So the whole notion of being open, I think, is fantastic.
He does have a 14-year-old brother who's a teenager. Yeah, so that ground's already been laid, but I have to say he's not presenting typical yet. So fingers crossed. Like, he kind of went the other way, where he was like maybe more difficult as a child, and right now, like, when he hit 13, 14, he like super matured. So I don't know if it's because of like her illness or because he was like in virtual school for COVID and now he's in person, that like, I don't know. This is my first time doing this. Maybe he's gonna hit 15.
Watch out.
Years. Pardon,
Yeah.
Sean?
Watch out when they hit 13. That's when all the.
That's what I mean. He's 14 now.
Oh,
And
okay.
he's been like super mature and like super wonderful. So I don't know. He was really hard from like 9 to 12 or like 9 to 11. And now like 13, 14, he's been like really, really good. So I don't know, maybe 16 is going to be really hard. Like, he's going to get a car and just like run away. I don't know. It's hard to know what's going to be in store.
Kristen, just a little note. I can relate to your daughter, because not that it's the same, but I didn't want people to know. I didn't want to be different with type 1 diabetes. And you know, there's so many things that are different. Social media, being open about conditions and all that stuff. So when you talk about it, it's, you know, she's not the only one, because I grew up with people around me that were in the same place. But and you know what? I know I'm really lucky. But with Lorna, she never took the car and ran away. She just, I don't know how I ended up with her, but you may just have the same thing with your son. You may just continue to.
Cross my fingers, the 14-year-old maybe.
Yeah, that's right. I would do this.
Yeah.
Both hands.
So far, okay. But she might be the one. She's my little daredevil risk child there. I don't know.
She sounds like she has a strong personality.
She has a very strong personality. Like I said, we don't say no. We say, how are we going to make it work? So maybe if we just stick with that. Yes, you can go there. This is how we're going to make it work.
So Christine, Kristen, Uzma, Sean, and Michelle, thank you so much for sharing today your personal stories on this kidney journey. And be rest assured that more than one person is going to be impacted personally by each of your individual stories. I'm going to pass the camera back to Sadia to wrap things up. But I want you all to know that those pictures of each of you will always be in the back of my mind, because I am taking that away myself. So I want to thank you personally for enriching my life this morning, for sharing your time with me here. And I hope you guys continue to do this. You're great at it.
Thank you, Dr. Silva, and thank you for sharing your story. I'm inspired by that, and I've learned a lot from that too, and appreciate that.
Yeah, thanks to everybody, Dr. Silva, everybody. It's really great listening and hearing your stories, because like I said before, some of them I can very much relate to. So thank you.
All right. Thank you, everyone, for joining us, for watching this webinar on body image and self-esteem, women's health. Please do reach out to the Kidney Foundation to connect with any of our speakers today. They're all amazing volunteer peer support volunteers for the Kidney Foundation, and be happy to share, again, in more depth, their journeys and what they've gone through, and provide one-to-one peer mentoring. That's what it's all about, sharing their stories. And the importance of mentoring in terms of, the key messaging of you are not alone. That's what we kind of go by here at the foundation. So you're welcome to reach out to us one-to-one, or even check out our virtual support group meetings that some of our speakers have talked about today at www.kidney.ca, or give us a call at 1-866-390-PEER 7337. And on the behalf of the Kidney Foundation and all of our wonderful, amazing folks today, thank you for taking the time to watch. Stay safe, stay positive, and stay healthy. Thank you.